Hello everyone, welcome back to the Shalakya Tantra lecture series. In earlier video we have learnt about Shalakya Tantra importance, its definition, scope of learning the Shalakya Tantra and the famous acharyas related to the Shalakya Tantra. In continuation with the Shalakya Tantra lecture series, this is the second lecture where we are going to learn about Sandhigata Rogas. Sandhigata Roga mainly occurs in Netra Sandhis. In Ayurvedic anatomy, we find the terminology called as Netra Sandhi, which is suggestive that transitional tissue zone of the eyes. There are total 6 Sandhis as like Pakshma Vartma, Vartma Shukla, Shukla Krishnagata, Krishna Drishtigata, Kaninika, Apanga. When you notice Pakshma Vartmagata Sandhi, there is a transitional zone between eyelashes and eyelid. Vartma Shukla, eyelids and scleral part. Shukla Krishna Sandhi between sclera and cornea. Krishna Drishtigata Sandhi where looks like transitional zone between Krishna and cornea and pupillary area. And when it comes to the Kaninika and Apanga, these are the edges of the width of the eye. They are forming two joints. One is Kaninika, medial joint, and lateral one is called as Apanga. Coming to the classification of the Sandhigata Roga, there are total 9 Sandhigata Rogas. Those are Puyalasa, Upanaha, Srava, Parvanika, Alaji, Krimigranthi. Among them, Puyalasa, Upanaha, Parvanika, Alaji, Krimigranthi are single in number and Srava are total 4 in number like Pitta, Kapha, Rakta and Sannipataja Srava. Similar classification is given by Vagbhata. Only thing is Vagbhata Acharya explained Jalasrava as a different Srava type in Sandhigata Rogas. Coming to the first disease, Puyalasa, it is explained as the first condition in the Sandhigata Roga. The reference is from Sushruta Uttaratantra 2nd chapter and Ashtanga Sangra Uttaratantra 10th chapter. It is of Tridosha Javadi and dosha are Mamsa and Rakta. Sandhi is Kaninika Sandhi is affected and Chikitsa it is Vedhana Sadhi. When we go for the clinical features of the Puyalasa as per Acharya Sushruta, Pakvaha Shofaha Sandhijaha Samsravetyaha Sandram Puyam Puti Puyalasaha Saha. That means Puyalasa is condition of the Sandhi where there is a Sandra Puya Puti discharge is there and there is a Paka is seen with edema and that condition is known as Puyalasa. Even Acharya Vagbhata also gives the similar type of explanation which goes Puyalaso Vranaha Sukshmaha Shofa Samramba Purvakaha Kanina Sandhavadmai Puyasravi Savedanaha. So it is a painful condition where it is with edema and congestion and it occurs in the Kaninika Sandhi and there is a small vrana is seen on the Kaninika Sandhi and there will be pus discharge. So which clearly indicates like it is suppurative type of the disease occurring in the Kaninika Sandhi. When it comes to the clinical features of the Puyalasa, it is suggestive that this is one of the suppurative condition occurring in the Kaninika Sandhi of the eye. And whenever there is a suppuration, always the treatment concept varies before the suppuration and after the suppuration. In Puyalus also, if there is a suppuration is not occurred established completely, Paka is not happened completely, then one can manage with Raktamokshana, Upanaha, Antahbahya Shodhana, Akshipaka Chikitsa and Anjana Yogas. These are the few Anjanas explained in classical text, Sushruta and Vagbhata, Saindhavadi Anjana, Kashishadi Anjana with Tamra and Loha. If there is a Paka completely occurred in Puyalasa Roga, then one can go for the Vedana Karma and Nadivrana Chikitsa. Acharya Vagbhata explains Dahana Karma in the management of the Puyalasa. Upanaha. This is the second Sandhigata Roga, where it is explained in Sandhigata Roga Adhyaya of the Sushruta and Ashtanga Sangraha, and it is mainly of Kafaja vitiation Vyadhi and dosha included in Upanahar, Mamsa, Rakta, and Medha. There is a slight variation in mentioning the involvement of sandhis as per Acharya Sushruta and Vagbhata. Sushruta explains that this is Krishna Drishtigata Vyadhi and Vagbhata explains it as a Kaninika Sandhi Vyadhi and it is Vedana Sadhya Vyadhi. When it comes to the clinical features, that is Lakshana of the Upanaha, Sushruta Acharya says, Granthir na alpo drishti sandhava pakaha kandu prayo nirujastu Upanaha. What it means? It means there is an abscess like growth which is not small, na alpo, which is not small and present in drishti sandhi and it is characterized with itching mainly and it is not painful. And that condition of the Sandhigata Roga is called as Upanaha. When it comes to the Acharya Vagbhata explains that this is one of the in his shloka he explains that Kafena Shopatikshagra Kshara Budbuda Kopamaha Prutu Mula Balaha Snigtaha Savarno Mrudu Pichilaha Mahan Apakaha Kanduman Upanaha Sa Nirujaha. The dosha involvement in the Upanaha as per Vagbhata remains same like Sushruta, that is nothing but Kapha dosha. There is a shofar and the shofar looks like a Kshara Budbudaka. It is just appearance like a Kshara Budbudaka and the edges of the growths are easily palpable. Prutu Mula Balaha and the appearance will be anxious. Snigdaha Savarno Mrudu Pichalaha. The soft swelling will be there and it is big. Mahan Apakaha. The big swelling and not with the Paka. That means there is no separation and associated with itching complaint and it is not painful condition. Slight variations been explained in Sushruta and Vagbhata's view. Other than that, all the symptoms are same. When it comes to the management of the Netra Rogas, Acharya Sushruta explained different treatment modalities for the different Netra Rogas. Like surgically treatable or treatable with medicine. They are termed like Shastra Sadhya, Aushadha Sadhya. Those all the categories been explained. When it comes to the treatment of Upanaha, already I have mentioned in earlier slide that Upanaha is one of the Bedhana Sadhya Vyadhi. There are total 5 Bhedana Sadhya Vyadhis, Upanaha, also Shleshma Upanaha, Lagana, Visagranthi, Anjananamika and Krimi Granthi. These are the 5 diseases where you are going to do Bhedana, that is nothing but surgical incision and drainage. Once after doing the surgical incision and drainage, you are going to apply the Pippali, Madhu and Saindhava Pratisarana in the management of Upanaha. When we see the commentary of Dalhana, we will get to know that in Upanaha condition, it is Vedana Sadhya. If it is a big size and without any pain, then go for the Lekhana Karma. If it is associated with Rakta, then go for the Prachana Karma. And no much symptoms are associated and clinical ideal features of the Upanaha are there, then directly go for the Vedana Karma followed by the Pratisarana with Pippali Madhu Saindava in all these conditions. When it comes to the Vagbhata's line of management in Upanaha Chikitsa, a similar line of management explained as of the Sushruta. Only in Shloka we can see there is a Svedana Karma as a Puva Karma explained in Vagbhata's explanation. Rest all remain same like Vedhana, Lekhana procedure and Pratisarana with Pippali, Kshaudra and Saindava remains same. Addition to that, Acharya Vagbhata explained Patola Patra and Amalaka Kvata Ashotana in Upanaha, which is advised as a different line of management in the Upanaha as compared to Sushruta. So that is the only difference you are going to see in the management of the Upanaha. Next Sandhigata Roga we are going to study is Netra Srava. Netra Srava is not a single disease. There are total 4 types in the Netra Srava. Here one basic information I would like to provide is the Netra Mala is mainly due to the Mala of the Majja Dhatu, and the Samprapti of the Netra Srava occurs in Ashruvaha Shrotas, and Netra Nadi is nothing but Netra Srava condition only. I already mentioned there are total 4 types of the Netra Srava as per Sushruta, Sannipataja, Kafaja, Raktaja and Pittaja. In addition to that, Acharya Vagbhata mentioned Jalasrava. Jalasrava as the one of the condition instead of the Pittaja Srava. And all the Netra Sravas are asadhya to treat. When it comes to the clinical features of the Netra Srava condition, already we know that there are Sannipataja, Kafaja, Raktaja, Pittaja varieties of Netra Srava, and the differentiation is mainly due to the type of the discharge. In case of Sannipataja, there will be Puya Srava is seen, which is not a similar type, it will be having different qualities. Na ekarupaha pradishtaha. Next comes in Kafaja, the discharge will be Shweta, Sandra and Pischila, and there is no pain associated in the Kafaja Srava. And when it comes to the Rakta Srava, it is because of the Raktaja, then definitely there will be Rakta Srava is seen, and it will be Ushna Srava, and it is not a less quantity, it will be more. That means profuse quantity of the discharge is seen in Raktaja Srava. And when it comes to the Pittaja Strava, it will be appearance like a yellowish colored or bluish tinged Ushna and watery type of discharge is seen. Jalabham is seen in Pittasrava condition. So to make it more simplified, you can go through the table of the Srava description, Netra Srava description. Here you can see the Puya Srava is Tridoshaja and not with the one type of symptom. It will be having multiple presentations. Mainly Puya Srava is seen, and there will be Puya is there, no, then definitely suppuration, then suppuration of the Twak and Mamsa is seen. And when it is comes to the kapha, it is a shweta like white color discharge. It is qualities are sandra, pichila and bahala and shita, and there is no pain associated in srava condition. And when it comes to the raktaja, the rakta and tamra is the color of the discharge, and it is not so hot and not so consistent discharge, and there will be excessive discharge in raktaja srava. And when it comes to the pitta srava, there is a yellowish or bluish tinge discharge, and it will be watery jalabha discharge, and it will be hot discharge from the eyes, and the appearance is from the sandhi madhya. The discharge will be appearing from the sandhi madhya, okay, and the quality of the temperature comparison will be hot in pittaja srava. When it comes to the Vagbhata's explanation on Srava, mainly he explained it occurs in Vartma Shukla Sandhi, that is Kaninika Sandhi, it occurs, okay, and it will be associated with pain and redness, and inflammation is seen in Jalasrava. Rest all almost Kafaja, Sannipataja and Raktaja are similar type of appearance presented as like Sushruta. Already I have explained like a similar to Sushruta's explanation. Vagbhata's Kafasrava remains same, Shweta and Pichila Bahalasrava, right? And when it comes to the Raktasrava, similar Raktasrava, then bloody discharge will be there. Only thing is a Tamra Varna. Along with Raktasrava, Tamra Varna extra is added in Raktasrava explanation of the Vagbhata. Rest all remains same. Puyasrava explain also remains same. Sravayanti Muhu Puyam. Puyasrava only will be there, but only one highlight he had given is Twak Mamsa Paka. As earlier we have seen in the table, we have seen that Twak Mamsa Paka is seen in Puyasrava as per Vagbhat. Coming to the treatment, all according to Sushruta and Vagbhata, Netrasravas, all types of the Netrasravas are asadhya, and Madhav Nidan also same. But here a small variation he has mentioned. Puya Srava is asadhya and rest Pitta, Kapha and Rakta are Yapya Vadis, and Chakradatta we see Patyadivarti reference in the management of Netrasrava, and Yogaratrakara explains Karpastyadivarti in management of the Netra Srava. When it comes to the Yogaratnakara, Vaishyajaratnavali, Triphala Kvata is best mentioned as the line of management in Netra Srava, but in different doshic involvement associated along with Triphala, you have to add, if it is a Kafaja Netra Srava, you have to add along with Triphala, you have to mix Madhu. If it is Pittaja, along with Triphala, you have to add Grita. If it is Vataja, along with Triphala, you have to add Pippali in the management of Netrasra. The next condition we are going to learn in Sandhigata Roga is Parvani. Parvani clinical features goes like Tamra, Tanvi, Daha, Shulopapanna, Raktatneya, Parvani, Vritashofa. This is a round circular inflammatory growth, okay, appearance like a Tamra Varna and a very small one, and along with the symptoms of Daha and Shula. That means pain will be there, okay. That pain, burning type of pain will be there, and it is mainly occurring due to the Rakta dosha. To see the more details, this is explained in Sandhigata Rogas, and it is due to the Rakta dosha, and Sandhi involved little bit variation is there. Shukla Krishna as per the Sushruta and Vartma Shukla as per Vagbhata. Chikitsa is says Chedana Sadhya, and the order of the Chedana is explained as Vedana, Chedana, Lekana, Pratisarana, followed by after the Lekhana one can go for the Shankadhya Achana. Why Shankadhya Anjana is advised after the Chedana procedure, I will explain in the management of the Parvani Roga. It is explained in Chedya Roga Pratisheda Adhyaya. Here you are going to excise the Parvani growth. One total three-fourth part of the Parvani is hold with the help of the Badisha, and the half of the Parvani is excised. Because if we excise more the half of the part of the Parvani, more than 50% of the Parvani is excised, then it can form the Ashru Nadi. That's why only half of the part of the Parvanika is excised, and remaining part is treated with the Achana. And in every surgical procedure, there is a Pratisarana explained. In earlier condition of the Vedana, we have done Pratisarana with Pippali, Kshaudra, Saindhava. Here in Parvani, Saindhava and Kshaudra is explained, and other Lekhaniya Churnas are also explained in the management of the Parvani Chedana. According to Vagbhata, similar symptoms been explained. Vartma Sandhyashrayaha Shukle Pitika Daha Shulini Tamra Mudgopama Bhinna Raktam Sravati Parvani. Sushruta explains like it is a Vrutta Shofa, and Vagbhata explains it as a Mudgopama. It appears just like a Mudga. If it get broke, or if it is incised, or if the content is opened from the Parvani, there will be blood discharge is seen, and that condition is known as Parvani. And Vagbhata also explained Parvani is managed with the Chedana Vidhi. It is Chedana Sadhya, similar type of the method to hold and to excise the part of the parvani is being explained, and along with pratisarana dravya also remains same. But in addition to that, one thing I would like to highlight here is Karanja Bija Siddha Gruta is explained for the Parisheka in post Chedana procedure as per the Vagbhata. When it comes to the difference between Sushruta and Vagbhata, Sushruta explains Vedana, Chedana, Pratisarana and Lekhana, and Vagbhata explains Chedana and Pratisarana along with other procedures. Next disease in Sandhigata is allergy. It is also explained in Sandhigata Roga, same reference of the Sushruta Uttar 2nd chapter and Ashtanga Sangraha 13th chapter, and dosha it is Tridoshaja. Again, the slight variation for the involvement of sandhis can be noticed here. As per the Sushruta and Vagbhata, Kaninika sandhi is involved in allergy, and Shukla Krishnagata sandhi is involved as per the Videha Acharya. And allergy is a asadhya vyadhi, and Lakshana goes like allergy syat tasminneva kyapita purvalinga. Purvalinga here is a refer to parvani. The symptoms are similar to that of the parvani, but here the tanutva tamra tanvi was the appearance of the parvani, that is not there here. Here the allergy will be stula in nature compared to the parvani, and it is as sannipataja and it is asadhya vyadhi. And when it comes to the Vagbhata, similar type of the presentation, Kaninasya Antaralaji Shofo Rukto the Dahavan is explained. And when you compare the Vagbhata's understanding, the Parvani and Alaji appearance, Mudkopama as the small, which gives the small growth appearance of the Parvani, and Gostanakriti, the size increase is understood here. And next come to the presentation, the Parvani is a Tanu, means a very milder form of the growth, and Stula a bigger form of the growth, and involvement is Rakta in Parvani Vyadhi and Tridoshaja in allergy. Symptoms are milder in Parvani and severe in allergy, and Parvani is a Chedana Sadhya. Surgical procedure is done, but it is Sadhya Vyadhi, and allergy is a Asadhya Vyadhi. And Netra Sandhi variation, Shukla Krishna and Shukla Vartma, and it is extended up to Kaninika as per the Vagbhata. Here we have seen the shloka Kaninasya Antarology. There will be extension up to the Kaninika. Disease we are going to learn in Sandhigata Roga is Krimi Granthi. It is same references will be of same chapters, and it is mainly due to the vitiation of the Kapha dosha. Sandhi included again small variations as per Sushruta Vartma Shukla and as per Vagbhata Apanga or Kaninika, and Videha explains similar to Sushruta as a Vartma and Shukla. And chikitsa it is a vedhana sadhya. There is a vedhana and bhedana two treatment being explained in krimi granthi treatment. And when it comes to the lakshana of the krimi granthi, krimir granthir vartmanah pakshmanascha kandum kuryuhu krimaya sandhijataha. There are the krimi will cause the kandu in pakshma, and they will present with the different types of the symptoms. Here different types of the symptoms are like there may be the pahaka, or there may be the itching, or there may be the inflammatory symptoms, like that different symptoms, presentations, clinical features are seen in krimi granthi. And one more, charanto antarnayanam dushayanti, so that means they may damage the internal structure of the eye. That kind of condition is called as krimi granthi. Again, in continuation with the Krumigranthi as per the Vagbhata's appearance, Apange va Kanine va Kandu Usha Pakshma Potaman Puyasravi Krumigranthir Granthi Krumirto Artiman. So there is a post discharge in Krumigranthi, and it mainly occurs in Apanga or Kaninika Sandhi associated with itching and burning sensation, and sometimes there will be ulcer-like appearance is seen in Krimigranthi appearance. When it comes to the line of management in Krimi Granthi, it is one of the Vedana Sadhya as per Sushruta. You are going to do the Samyak Vedana, then you are going to do IND. After the IND, the Pratisarana Dravya, slight variation is there as compared to earlier diseases. Trifla, Tutta, Kashisa, Saindhava, Rasa Kriya is applied. Vagbhata also mentioned the similar type of the treatment, but a slight variation or a particular Svedana type is mentioned as per the Vagbhata. Karisha Svedana is explained in Krimi Granthi, and after that followed by incision and drainage and Lekhana. The Pratisarana Dravya remains same except Tutta. In Sushruta, Trifala, Tutta, Kashisa, etc. are explained, and in Vagbhata, similar formulation except Tutta, Trifala, Kshaudra, Kashisa, Saindhava is explained for the Pratisarana after the IND procedure. Okay, that's all about Sandhigata Vyadis explained by Sushruta and Vagbhata with the comparison study. And among them, a few highlights would like to mention here are Puyalasa, Upanaha, Krumi Granthi are very important diseases among the Sandhigata, and they are oftenly asked in the long essay questions. And any doubts in the current lecture video, you can post them in a comment section. And along with that, if you want any topic video to be made, you can request in the comment section. Till then, bye, and in future we will be coming with Drishtigata and Sarvagata Netra Roga. Thank you.